tanıtmaktan onur duyuyorum. Çünkü gerçekten Seffiline serisini, Seffiline serisine elime almasını sağlayan o güzel patentli ve pratik patentle tanışmaktan mutluluk duyuyorum. Kısaca bir özgeçmişinden bahsedeceğim. Profesör Gianni, plastik rekonstrüktif ve estetik cerrahi, plastik rekonstrüktif ve estetik cerrah, genel cerrahi uzmanı, estetik tıp mezunu, Bologna Studio Gianni'de plastik cerrahi ve estetik tıp merkezinin tıbbi direktörü, Tor Vergata Roma Üniversitesi'nde öğretim üyesi, İtalya Pisa Üniversitesi, İtalya Modena Üniversitesi ve Reggio İtalya Otolog Rejeneratif Tıp Derneği bilimsel direktörü, terapi ve tam üyesi ve İtalyan Plastik ve Estetik Cerrahi Derneği, Avrupa Akademisi Plastik Cerrahi Derneği ve İtalyan Estetik Tıp Derneği, Amerikan Estetik Tıp Akademisi gibi birçok derneğe üye ayrıca. Gelelim kendisinin güzel yeteneklerine. Plastik ve estetik cerrahi alanında minimal insizyonlarla dikey endoskopik kaldırma, derin yapay bağlarını kaldırma, Seffiline mikrosefi yüzeyel geliştirilmiş sıvı yağ enjeksiyonu gibi orijinal tekniklerin yaratıcısı, Seffiline tıbbi cihazlarının gelişimi ve tekniğinin doğmasına sebep olmuştur. Aynı zamanda tüm Seffiline tıbbi cihazlarında bulunan standartlaştırılmış, güzel ve güvenli bir şekilde bizim şu anda kullandığımız doku hasabını gerçekleştirmek için patentli kılavuzun mucididir kendisi. Rejeneratif tedavinin yağ dokuyu çıkarma alanında deneyimi olmayan hekimlerin bile bu alanda kolaylıkla hasat almasını sağlayan cihazın patentini kendisi oluşturmuş. Ayrıca yine hem saç hem cilt için Seffile'nin yanında bir de ortopedi ve jinekoloji alanında da yine Seffiline ve Seffiline alt grupları mevcut. Ve son dönemlerde de egzozomla ilgili güzel çalışmaları var. İnşallah yakında onlarla da tanışacağız. Çok sayıda kurslar, konferanslar ve aracılığıyla bizlere ulaşan ve yanımızda olan Giovanni'nin şu andaki sunum için kendisine mikrofonu veriyoruz. Zaten yakın mikrofonu var.
Thank you. Thank you. Okay. Good morning, everybody. It's a great pleasure for me to be here in Istanbul. It's a wonderful city, wonderful country, and I wish to thank Dr. Eyüp, eminent colleague and my close friends, for inviting me here, and of course, Dr. Sariata, that will help us for the translation, because I'm sorry, but I don't speak Turkish, and so I'm holding this presentation in English, but you can get your question in Turkish, and she can translate for me, and so it's more easy to question and answers. In the last 15 years, I've been focused my attention in the regenerative therapy, and it's a great pleasure for me to sharing with you my knowledge in this field. And I think that now with this unique devices from Seffiline, we are opening a new era in the regenerative therapy. The mission of this kind of devices is to make the regenerative therapy simple, safe, effective, standardized. This is very important because before this kind of devices, the regenerative therapy is a very interesting procedure, but it's a little bit a surgery procedure. Now this procedure is for doctor without any surgical skill, and now I'm introducing you this new concept of regenerative therapy. First of all, when we talk about regenerative therapy, we are talking about autologous, homologous, fragmented adipose tissue graft that leverages the power of the stromal vascular fraction, the mesenchymal stem cells, the growth factor, and exosome to restore and repair our tissues. One most important thing is that when we talk about regenerative therapy, we are not talking about the lipofilling or the only fat graft, but it's a tissue graft. The reason why, when you perform the regenerative therapy, of course, we are harvesting also adipocytes. But for us, the most important part of our therapy is the stromal vascular fraction. The stromal vascular fraction is the most important part of the tissue in order to perform the regenerative therapy. Because in the stromal vascular fraction, you can find all the cellular population that are most important for repair and regenerate our tissue. The adipose-derived stem cells, the growth factor, the exosome. And so, remember, when we perform the regenerative therapy, for us, the adipocytes is not so important. The adipocytes is only a biological filler, but the most important part is the stromal vascular fraction. This is the most important part of our tissue. Of course, the properties of the mesenchymal stem cells are, first of all, the capacity of these stem cells to transform in adult lineage of mesenchymal tissue as adipocytes, as chondrocyte, osteocyte, and others. And it's important because when we inject the stromal vascular fraction, we're also injecting the fibroblast. And so we are injecting the cells that have the capacity to create new collagen in our tissue. And of course, the growth factor, the endothelial growth factor that increases the vascularization of our tissue, but also the fibroblast growth factor that stimulates the fibroblast to produce collagen. And also the capacity of homing. These cells have the capacity to migrate in the area where we need to repair the tissue, and they have antifibrotic activity. But another important part, the new field in the regenerative therapy, is the study of exosome. Exosome is very important because the exosome is like the microvesicles, is like the email from one cell to another. And so it's important for exchange of information between cells. And the exosome contains lipids, protein, and fragment of mRNA messenger. And so it's extremely important for the homeostasis of our tissue. And now our research is focused on this part of the tissue because it's extremely important. Remember, when we talk, there is a lot of claim about exosome now in aesthetic medicine also, but the most important, in the market, there is exosome from vegetal exosome or heterolog exosome, but now we are talking about autolog exosome that is more important and more safe for our patients. Another important concept when we are talking about regenerative therapy is a therapy, is not a filler, is a therapy for our tissue. And so it's extremely important to understand that this therapy is dose dependent. More cells you put in your patient, more effect you have. This is very important. And so when we talk about a procedure for regenerative therapy, it's extremely important to know how many cells this procedure can yield for our patient. And so it's not all the procedure the same. It's important to perform for our patient the best procedure with the higher amount of cells that you are going to inject. This story of this kind of devices comes from this technique, the Seffiline technique. I published this technique, the superficial enhanced free fat injection, in 2015. The concept of this technique changing the paradigm of the regenerative therapy. Because in my concept, before the Seffiline technique, the doctor harvested the tissue, and now unfortunately, again, with a big cannula. And so they are harvesting a big cluster of cells. And if you harvest the tissue with a big cannula, with a big site for soul, you are harvesting a big cluster of cells. And if you harvest a big cluster of cells, in order to inject superficially, as you have to perform for regenerative therapy, you need to manipulate the tissue. And if you manipulate the tissue, I will show you, and we proved, that you reduce the viability and the stemness of your tissue. The concept of Seffi is completely different. We are going to select the right dimensional cluster during the harvesting procedure. And in this way, you don't need to manipulate the tissue, and so you maintain the higher level of viability and stemness of your tissue. And this is extremely important because if you remember, I said that regenerative therapy is dose dependent. And so the highest amount of cells means the highest result in your therapy. And so with the old system of harvesting tissue, to produce in the market a lot of devices. All these devices are merely the cluster reducer. If you harvest the tissue with a big cluster of cells, of course, as I told you before, you need to reduce the dimensional cluster. And so in the market, you have a huge of devices that are only the cluster reducer, are mesh, metal balls, or filters, or all these kind of devices are only the cluster reducers. They mean to reduce the dimension of cluster. But if you use this concept of, the Seffi concept, you don't need any kind of device to reduce the cluster. Because with the microcannula, you already harvest the right dimension of cluster, and so you don't need to manipulate the tissue. And again, remember that anytime you manipulate the tissue, reduce the viability and the stemness of your tissue. Of course, we have a lot of references and a lot of studies about this concept. We prove the capacity of these stem cells to transform in a mesenchymal adult lineage. We published this paper in 2020, I guess, in Aesthetic Surgery Journal, and we proved that with our technique, we can, the stem cells have the capacity to transform in adult tissue. And again, when I published in 2015 the Seffi technique, it was a minimally invasive, but was a surgical procedure. But in 2020, I published the evolution of the Seffi, and I introduced this kind of procedure. And so I transformed the surgical procedure in a medical procedure. How is it possible to transform a surgical procedure in a medical procedure? This is possible thanks to this patented guide that allows doctors without any surgical skill, any skill in liposuction, to perform the procedure in very easy, safe, and effective way. How does it work? This guide allows the microcannula Seffi, to come out only 15 millimeters, and it's far away from the blade of the cannula, only 15 millimeters. And this is a magic number, because with two magic numbers, when you introduce your cannula in your patient with a very small hole that you perform with a needle, you can penetrate only 15 millimeters. Also, a doctor without any surgical skill, any liposuction skill, don't have any kind of concern, because when you introduce your cannula, you cannot go deeper than 15 millimeters, and so you are safe. The procedure is extremely safe. And after that, you turn your system, and your cannula is going to harvest the tissue in 15 millimeter depth. And when you harvest the tissue in 15 millimeter depth, you have two advantages. The first of all, you are in a very safe plane, because nothing can happen in 15 millimeters under the skin. But the second important thing is that we proved that the superficial adipose tissue, the tissue closer with the dermis, is richer in stromal vascular fraction. And again, remember, the regenerative therapy is dose dependent. And so if we perform a procedure that yields the higher amount of cells, you have the best procedure. And so with this guide, you standardize your procedure in harvesting the tissue where there is the highest amount of cells of the stromal vascular fraction. And so, starting from this concept, we standardize 4 different devices. The Seffiline is designed for an aesthetic physician to perform the regenerative therapy in aesthetic medicine. Seffiline is designed for dermatologists or aesthetic medicine, tricologists that want to perform the regenerative therapy for androgenic alopecia. Seffiline is designed, of course, for doctor, for gynecologist, and other doctors that want to perform the regenerative therapy in intimate medicine, regenerative medicine. And last but not least, Seffiline. This is a device that is meant for orthopedics, vascular surgeon, for healing the wound healing and pain therapy, and so anyway, all for the other kind of therapy. And so, in conclusion, which are the strengths point of these devices? First of all, as I told you, for me the main concept is the power of simplicity, because the simplicity is the real power of this kind of devices. First of all, using a microcannula, you don't have to manipulate the tissue, and this is extremely important because, as I told you, if you manipulate the tissue, you reduce the viability and the stemness of your tissue. The second important point, this is extremely important. We proved, we published this study comparing the viability and the stemness of these devices with the other devices that involve the manipulation. And you can see the number. The number is important, remember, because it's dose dependent. Look, in T0, if you don't manipulate the tissue, you obtain 250,000 viable cells for ml. If you manipulate the tissue in T0, you have 15,000, a big difference. But the most important thing that after 72 hours, T72, you have the growth rate is boosted the growth rate, and you arrive to 3 million of cells after 72 hours. If you see the device that involves the manipulation, after 72 hours, you have the same amount of viable cells. And this means that the manipulation not only reduces the viability of the cell, but reduces also the growth rate. And this is extremely important when we talk the efficacy of a procedure. And last but not least, in another work that we published last year, we proved that this tissue contains a lot of human mesenchymal stem cells. With the flow cytometry, we proved the quality of the tissue. So not only the viability, but also the quality of the tissue. Another strength point, we don't use any kind of mechanical device to manipulate the tissue. The concept, as I told you, you harvest the tissue in the right dimension of cluster, and so you don't need any kind of mechanical manipulation. And this is very important because I said you, of course, mechanical manipulation reduces the viability, but also when you have to manipulate the tissue, you have to harvest more tissue because during the manipulation you waste a lot of tissue. If you don't manipulate the tissue, you don't waste the tissue, and so you harvest only the amount of tissue that you use, and so it's less invasive and more safe for your patient. Another strength point, with the guide, you harvest the tissue where there is the highest amount of stromal vascular fraction because you are harvesting the site, superficial adipose tissue. And in the superficial adipose tissue, you have the higher amount of stem cells. The system is disposable. And this is another important part, is all-in-one and disposable. And so this one is extremely simple for the doctor to use this kind of device, but is extremely safe also, because when you use very micro cannula and so on, it's extremely important to have all the material disposable. One patient, one device. Another important part is the low dose of anesthetic solution. Because when you perform a medical treatment, it's important to use a very small amount of anesthetic solution because you are doing your procedure in your medical facility. And so if you have to inject a lot of anesthetic solution, a tumescent solution is not a medical procedure, but becomes a surgical procedure. But with this procedure, you are injecting the anesthetic solution with the same guide. So you inject the anesthetic solution only in the layer where we are going to harvest the tissue. And so you use only 30 ml or 40 ml of anesthetic solution. And the low dose of lidocaine, the low dose of anesthetic solution is in a strength point for the safety and for the safety of the procedure and transform the procedure from surgical to medical procedure. Another important part, the fast of the procedure. This procedure takes no more than 30-45 minutes from the entry of the patient to the out of the patient from your facility. And because you don't waste time in manipulation of the tissue, don't waste time in inject a big amount of anesthetic solution, so it's extremely fast procedure. And this is another strength point for the safety. And last but not least, for this procedure is not required a surgical room, but it's possible to perform in a medical facility. Okay, this is a introduction of the concept of the regenerative therapy and the concept of this kind of device. Now I'm starting to introduce you the Seffiline, that is a device designed for aesthetic doctor for regenerative therapy in aesthetic medicine. Now, if you have any question about the first part of my presentation, it will be a pleasure for me to share with you your opinion. So if you have any question, you can get the question in Turkish, and Dottoressa Riatta can translate for me. If there is no question, we can, okay.
Diciamo che i nostri pazienti, qualcuno che ha fatto per esempio il cardiomagneto, hanno fatto sciolto le poligrassi, ci sono dei problemi, se hanno fatto questi trattamenti, tutti questi trattamenti, dove lo prendiamo questo tessuto, se ci sono problemi.
Okay. Remember that the regenerative therapy is for te lo dico in italiano, traduci come preferisci. You prefer I speak in English or in italiano tu traduci in English so we can understand everybody. Okay. The regenerative therapy, remember this, the third slides, I guess. For us, the most important part is the stromal vascular fraction, is not the adipocytes. And so if you perform some therapy to reduce the volume of the adipocyte, is not important for us, because for us the most important thing is the stromal vascular fraction. The only thing, if in the area where you harvest the tissue, the patient before performed a liposuction, because there is a little bit of fibrotic tissue. The only concern in this kind of situation is that when you harvest the tissue, you are vesting also little fragment of fibrotic tissue. And sometimes when you go to inject the tissue, the cannula can clog a little bit. And so you have to have some spare cannula to perform the procedure. But the only problem could be if you perform the liposuction before, just for clogging the cannula. It's not a problem of the quality of the tissue. Because for us it's not important the adipocytes, it's important the stromal vascular fraction. That's it.
Thank you for your presentation. You are doing on your videos also, you are doing all the procedure on the abdominal region. What about abdominal region?
Yeah.
What about the other part of the region? Well, we are talking about just on the adipose tissue. Some patients don't have enough adipose or any area in the abdomen, so we can use actually the leg side, but the leg side is sometimes, I think, according to my experience, it is not give a good stromal vascular fraction.
Okay. From the study, there is not a big differences in between the different area in the stromal vascular fraction. Anyway, you can harvest the tissue wherever there is a fat depot. It's enough there is 2 centimeters of fat, and you can harvest the tissue. Of course, the most frequent area where we are going to harvest the tissue is abdomen and trochanteric area. But for example, in men, for the Seffiline hair, a lot of time is the hip. And so, anyway, you can harvest wherever you want, inside the thigh or the knee. The only thing is there is no difference in the amount of stromal vascular fraction. My personal suggestion at the beginning, when you start to perform this kind of procedure, the easiest part to harvest the tissue is the trochanteric area. The patient is super relaxed because it's one side. It's enough to harvest only one side. You don't need to treat both sides because there is no any concern about the irregularity or asymmetry because you are harvesting very few amount of tissue and very superficial. And so you can harvest wherever you want, where you have enough 2 centimeters of adipose tissue.
One more question. What about the vaginal injection of the mesenchymal stem cells? Is it work like the laser for the construction, for the fibrosis, and for the collagen production? Is it work like this or not? Is there any experience about this?
Actually, I'm not gynecologist. Anyway, the gynecologists that work in the team use both the laser, Mona Lisa or other kind of laser, and the regenerative therapy. The concept is that the laser is a good treatment, enhances the quality of the mucosa, but, for example, have not the capacity to increase the quality and the thickness of the mucosa. And so, if you perform both treatment, you can have the best result in the syndrome, in the postmenopausal syndrome. We published an interesting, and if you want we can share with you, an interesting paper, an interesting study treating the patient with this kind of syndrome, postmenopausal syndrome, with injecting the stromal vascular fraction and the Seffi gene, and we proved that in 6 months you reduce all the problem of the postmenopausal syndrome. And so I think that you can combine the 2 treatments without any kind of problem.
Okay, what should be the interval between the both kind of the treatment? For example, if we are doing the laser treatment, after the laser treatment, it must be first the mesenchymal stem cell injection and then the laser, or the first the laser, then the stop the laser treatment, and this one, which one?
Okay. As you see in the presentation of Seffiline, a lot of time we combine, for example, fractional laser with Seffiline in the same section. It's possible without any kind of problem. You can combine the same section. But for the comfort of the patient, you can organize to don't perform the same procedure in the same session. And so, but the interval between the 2 treatments could be 1 week, no more. There is no problem. After 1 week, you can perform before laser, after laser. It's up to you.
And also nowadays, there is bleaching in the genital area. It is very common, and it is a really big problem. We cannot have the really good results from the Mona Lisa touch or something for the bleaching. I think it is working in the bleaching. And I use and I experience about the especially genital area bleaching, as applying on the skin area, the mesenchymal stem cells, I think it is work, but it depends to do the damage area. If it is a damage, too much damage by the ablation, it is little. But if it is the without any ablation or any traumatic procedure in Turkish people, and it is really, really good working. And also I have experience, I think your gynecologic part is little more the big part, because I use also in G point augmentation, and it is really, really very, very well work. And also I use in the OSHA, you know.
Anyway, I repeat, I'm not a gynecologist. I cannot enter in the specific of the treatment and the indication of the regenerative therapy. And I will share you the paper about this kind of treatment and also the video how to perform this kind of procedure. The only thing that I can say that you can use the regenerative therapy for intimate rejuvenation and also for GSM syndrome. You can use for both. And in our paper we prove that all the symptoms of the GSM syndrome reduce of 90% after 6 months. And so you can use inside the vagina or outside in the major labis or in major and minor labis. You can inject for intimate rejuvenation or inside the vagina for the GSM syndrome. And so about the indication, of course, I'm not gynecologist, and so I cannot answer about this, but I can share with you the video and the paper about this.
I will be
Please.
Thank you for the great presentation. I'd like to ask, maybe you mentioned during your presentation, but in that point I would like to ask if it's important the patient's age, because also tissues are aging during the yearly. So for the donor area, is that the problem that getting the
About the age of the patient?
Yes.
Yeah.
Because of the tissue.
Okay, it's a good question, this one, because I think that, for example, you know that usually the tissue that is used in regenerative therapy are two kinds of tissue, the bone marrow and the fat. And in the bone marrow, in aging, there is a drastic reducing in the amount of stem cells. In the adipose tissue, the average of stem cells remain also in aging. And so it's not so important the age of the patient. Of course, we are expecting that in a 70 years old patient, there is less stem cells than in 30 years old patient. But it's possible to perform the regenerative therapy also in elderly people, because in the tissue there is mesenchymal stem cells for sure. In case you can repeat the treatment more frequently in elderly people. For example, as I will show you, usually I suggest to my patient to repeat the treatment after 6, 8, 10 months, depends on the condition of the patient. But for elderly people, at the beginning, for example, the first year, you can suggest to repeat after 4 or 5 months. And so you can have the good result, because remember, the regenerative therapy is dose dependent. And so if you have less stem cells, if you want a good result, you increase the treatment in the year span. Okay? Okay, we can go on?
One more question. I'm sorry, I'm struggling with you. What about is there any experiment or any experience about your gynecological team about the menstrual cyclus? That means when we are taking the stromovascular tissue, because we know this in the adipose tissue there is estrogen receptors at estrogenal hormonal level, and it affects the woman's cycle. If we are taking the adipose tissue, some vascular areas, stromovascular fractures, if we are taking. So I think, I don't have experience, but I am wondering, just only wondering, you have any experience or about your gynecological team, is there any experience like this? Because we know the estrogen hormone is the differs between the menstrual cycle, the point,
the
menstruation, the time of the menstruation, the period of the woman, in the beginning of the period or the late side of the period, is it differs about the stromal vascular fracture? Because adipose tissue has estrogen and also affects the hyperplasia and neovascularization in all body actually, and actually the age of the body.
Actually, we didn't investigate about the amount of stromal vascular fraction in the different period of women. Maybe there is an hormonal influence about that, but I think that, and so could be an interesting work or an interesting study to perform in this way. Actually, we don't have any evidences about this kind of difference. We are publishing a case report of more than 2,500 cases in a multi-center study in Italy. And actually, we didn't have any kind of difference. Consider that the greatest amount of the patients that perform the regenerative therapy, a lot of time are in menopausal period. And so, actually, I don't have any evidences between the differences, but it could be a good work to perform in the next future. Okay, we are going on with the Seffiline for aesthetic medicine. Okay, the concept of the Seffiline in aesthetic medicine, of course, it leverages the power of the stromal vascular fraction, mesenchymal stem cells, growth factor, and exosome, in particular to regenerate the skin and restore the volume. The reason why we know that the most important factor that involves in the facial aging is the loss of volume, the aging of the skin, and the descent of tissue. And when we perform the regenerative therapy, we are going to focus the treatment in the two main factors of aging of the face. Because regenerate the skin and restore the volume and the tone of your tissue. Now I will show you the procedure so we can understand deeply the concept of the Seffiline procedure. First of all, the anesthetic preparation. As I told you, it's important to know that we use only 30 ml of anesthetic solution. But both with 30 and 40 ml, we use only 10 ml of lidocaine 2%. The differences is only in the amount of saline solution. And so it's extremely safe for the patient because I'm using only 10 ml of lidocaine 2% for all the procedure. It's not a tumescent technique, it's only injecting in the superficial adipose tissue. And so you can see this is a video manual for the treatment. After that, of course, the anesthetic solution is not included in the device. And so we can go a little bit faster in this side because I will show you. Okay. And now we go to the preparation. Okay. This is the device. As I told you, is a device all-in-one. You can start the procedure without gloves because you are touching only the outside part of the drape, and so you can open your device on your table, open your drape, and you can have all the material inside your device. Okay, you prepare the device on your table. Now, of course, you have to use the sterile gloves after to open the device, and you can find all the material inside. You have the 3 cups. 1 cup is for anesthetic solution, 1 cup is for the saline solution, and 1 cup is for disinfectant, skin disinfectant. I used to put the cap of the syringe in the cup where I put the anesthetic solution just to avoid any kind of mistake in injecting. You have a drape for the harvesting area, and so you can cover the harvesting area with a sterile drape. And after that, the first step is to make a little hole in the lateral part of the harvesting area you inject a little puff of anesthetic solution, and then with the needle that is inside inside the device, you can make a little hole in the skin. You enlarge a little bit because the needle 18 gauge is 1.7 millimeter, the cannula is 2 millimeter, so you have to enlarge a little bit. The most important thing that you are injecting the anesthetic solution with the same system that you are going to harvest the tissue. And so you are injecting the anesthetic solution just in the superficial adipose tissue. You don't need to mention the anesthetic solution, but you are injecting only in the superficial area. And so you use only 30, 40 ml of anesthetic solution. Then you penetrate in the skin, 15 millimeter, no more. The guide stops your penetration 15 minutes, so you don't have any concern to go deeper. You turn and you start to inject the anesthetic solution. You are injecting 15 millimeter in the superficial adipose tissue. Just in the plane, we are going to harvest the tissue. And so you are gently inject the anesthetic solution. You have a fine movement just to inject 30 ml of anesthetic solution. The same procedure for the abdomen, the same procedure for the trochanteric area, for the hip, is all the same procedure. Very easy. The simple, the power of simplicity. After that, you have to wait 10 minutes just to make the adrenaline, and then you start to harvest the tissue. Insert your syringe, the backlog syringe inside the system. You lock posteriorly in the guide, and then the same thing. You penetrate 15 millimeters, rotate the system, go inside under the skin, okay, rotate under the skin 15 millimeters. It's completely painless because you already inject the anesthetic solution. The blade is touching the skin, so you are sure that you are vesting in 15 millimeters. You pull the plunger, rotate clockwise, and your system is in aspiration. At this, now you move back and forth very gently, and you can see that the tissue starts coming inside the syringe. The tissue is already fluid, is already liquid, because you are vesting the right dimension of cluster. You are not performing a liposectomy. You are performing a cluster selection of tissue. And so you have the tissue inside the syringe. After that, you transfer the tissue in the reservoir syringe, the blue one syringe that are inside your device, with the transfer that is inside the device. With this transfer, without any filter, without any kind of cutting tissue, you transfer the tissue in the reservoir syringe, then you fill it up with saline solution, you cap the syringe and put for decanting in the slot. You put it for decanting in the slot. That's it, no more. You repeat the procedure for 2, 3 syringes, depends on the amount of tissue that you need for your treatment. After a few minutes, you have the separation of the tissue and the washing liquid. Then you discharge, you don't move the syringe, you discharge the washing liquid, and you maintain only the tissue inside your syringe. Remember, this one I want to focus this point. I stop a little bit. Okay. The decantation and the washing the tissue is meant only to wash out the anesthetic solution, because the lidocaine is a little problem for the cells, for the viability of cells. So it's important to wash out as soon as possible. But don't be worried about the redness of your tissue. Sometimes the tissue is a little bit more red. It's not all the time yellow. But don't make more wash of your tissue, because anytime you wash your tissue, you are losing cells. And so it's better to have a little bit of blood in your tissue. There is no problem, because in the blood there is a platelet, you have growth factor. So don't be worried about the redness of your tissue. You wash only one time, because the washing and the decantation is only meant for to wash out the lidocaine and not to wash out the blood. Sorry. Okay. Going on. Okay, now you have the tissue in your syringe. You transfer the tissue in only one syringe, because now you perform, depends, but we are talking about the fluidification. This is another important item that we are going to introduce you, the fluidification. After that, you transfer the tissue in a smaller syringe to inject, and the tissue is ready to inject. This kind of procedure is the same for all the procedure, Seffiline, Seffiline, Sefficare. The only differences is with the Seffière, and I will show you, because for Seffière I will to explain you another concept, but we are talking about later. Okay, now the concept of the fluidity. Remember, we are vesting the tissue, we wash out the tissue with decanting, we wash out the lidocaine, and then the concept of fluidity. When we perform the regenerative therapy in the, for example, in the face, you know that in the face, first of all, when you inject the tissue for regenerative therapy, you have to inject as superficial as possible. But you know that in the face there's the thickness of the skin and the thickness of subcutaneous tissue is different from an area to another. For example, the thickness of the skin in the malar and zygomatic area, or the thickness in the skin in the eyebrow or in the on the lid is completely different. Also, the thickness of subcutaneous tissue, and so sometimes you need to have different fluidity of the tissue. Well, in our system, to change the fluidity of the tissue, you don't use any kind of device, you don't have to use any filter, any grinder, nothing. You only to increase the passages from one syringe to another. The concept is, when we talk about the cellular cluster, consider a grape, okay? When you make the passages from one syringe to another, you open the grape and you distract the cells. And so, increasing the passages from one syringe to another, you decrease the dimension of cluster, and so increase the fluidity. Of course, remember that more you perform passages, more reduce the volumizing effect of your tissue and increase your regenerative capacity of your tissue. So, remember that, repeat, increasing the fluidity of the tissue, so increasing the number of passages from one syringe to another, you decrease the volumizing effect of your tissue and increase your regenerative therapy of your tissue, okay? Usually, for the face, I use only the 2-3 passages, the 600 micron or 500 micron for all the face. It's the right method, but we'll talk about this one. This is a entry-level slides to show you the fluidity that I use in my patient. 90% of the case, of course, any time can change the situation, but this is a slide that can orient you about the first treatment. For the temporal, malar, zygomatic, jawline, I can use 2-3 passages, 600 micron of tissues. You have to decrease a little bit, so increase the fluidity when you, for example, are injecting the eyelid, the superior or inferior, and in that case you need to have a more fluid tissue, and in this case you are injecting the 500 micron. But anyway, with the 500 and 600 you can treat all the face. The plane where you are injecting the tissue, this is another important concept. As I told you, when you perform the regenerative therapy, and this is another important differences between the lipofilling. You remember when you talk about lipofilling, you have to inject deep, a big amount of tissue to increase the volume. This one is not a volumizing, it's not a filler, it's not a volumizing treatment, it's a regenerative therapy. And so you have to inject your cells, you have to think to sewing the cell, you have to sewing the cells under the skin, you have to create a carpet of cells under the dermis, just to increase the regenerative capacity of your cells, of your stem cells, of your fibroblasts, growth factor, exosome, and so you have to inject as superficial as possible. And so you are injecting all the time under the skin. The only area where I will show you that I suggest to inject under the muscle is in the periocular area, in the lid, because in this area the skin is attached to the orbicularis muscle. And so it's quite impossible to inject under the skin, and you can create some irregularities and some lumpiness. And so it's better to inject under the orbicularis muscle. And if you have time, I will show you the technique to inject the periocular area. Okay, talking about the volumizing effect. Remember, when you perform the regenerative therapy, your goal is to toning up the face, and so quite a volumizing effect, and regenerate the skin. Talking about the volumizing effect, this is the diagram that you are expecting with your patient. At the beginning of your treatment, of course, you have enhancement in volume because you are injecting tissue, and so you can see the volume in the face of your patient. But pay attention and advise your patient that in the first month, this volumizing effect decreases very quickly. And after that, the volumizing effect increases when the stem cells transform in adipocytes, and the volume that you obtain is long-lasting. And so remember that the regenerative therapy is a diagram like this. Decrease very quickly in the first month, and after that, increase and long-lasting. Remember that this one is not a filler. And so when you inject the filler, you have a local volumizing effect. When you inject the regenerative therapy, you have a total toning up of the face. The cells moves, is a viable cells, and so moving your tissue. And so the effect is all over the face, is moving the cells. And so when you have the regenerative therapy, the result is a full face result, is not like a filler that enhances only the area where you are injecting your tissue. And you can see here, you can see that the cells is moving around the face and move to go to regenerate the skin, where it's more important to have this kind of regeneration. Remember that the mesenchymal stem cells have the capability to migrate where the tissue has more regeneration. Again, you can see after 35, you can see this is immediate after the treatment, this is after 45 days. You can see the differences. The blue is like the enhancement in volume. You can see that after 1 month, 2 months, you have the movement of the cells and the toning up of the face. Okay, the regenerative effect. I will show you this one because it's important, yet you have to communicate to your patient. Your patient has to know what they have to expect of this treatment. Because of course, 90% of our patients are usual to perform the filler, and so this kind of dynamic of the results is completely different. This is the skin enhancement, the quality of the skin. You can see the first month, you don't see anything in your skin, of course, because you can start to see the enhancement of the quality of the skin when start to work their mesenchymal stem cells, the growth factor, the exosome, the fibroblast, and so after 1 month, start to enhance the quality of the skin. And you can see that after 42 days, after 1-2 months, you decrease the wrinkles of your face because start to work the fibroblast, the growth factor. Again, you can see the dramatic enhancement after 3 months of the quality of the skin. This is another important fact. And I want to say that this kind of regenerative therapy, there is no other treatment, injectable treatment, that can achieve this kind of results. And so, remember that the filler is dose dependent, and when you inject the cells, you have a great amount of cells that you are administrated to your patient. Some results, of course. Okay, you can see the enhancement in the quality and the toning up of your patient. You can have the result is for full face result. You can see the treatment, the movement of the cells in your face, before and after 4 months. I wish you you appreciate the enhancement in the quality of the skin. Remember, it's not a volumizing treatment, it's not a lipofilling, it's not a filler. This one is a regenerative therapy. Our goal is to regenerate the skin, is to perform a prevention and cure of the aging of your patient. After 6 months, also in younger patients. After 1 month, 4 months, 6 months, you can see the increasing in the quality of your tissue. Again, after 1 month, 36 months. 13 years after the treatment of regenerative therapy. This is my favorite slides, because in these slides you can concentrate the concept of regenerative therapy. You stop the aging of your patient, because you stop the aging of the tissue of your patient. Okay, another important concept that I wish to share with you is that regenerative therapy is not to change your habit to treat your patient. You have to combine the regenerative therapy with a procedure that you usually do in your medical facility. But the regenerative therapy must be the center of your activity, because it's the cure for the tissue of your patient. And any kind of treatment that you can perform with your patient have the best result if you working in a very in a very healthy tissue. And so it's extremely important to achieve a healthy tissue of your patient just to have the best result in your treatment. And so here I summarized some of the most important combination with the combined protocols with the Seffiline. For example, the hyaluronic acid and the hydroxyapatite, or the radiesse, the combination with the microneedling, with peeling, with laser, but also the association with the threads, the suspension thread, or association with endolift. And so all these procedures can combine for the best result with your patient. And now I wish to focus your attention, for example, in the combination with hyaluronic acid. Of course, we published a paper where we proved that it's possible to combine the hyaluronic acid with the regenerative therapy, because the hyaluronic acid play a role of scaffold for the stem cells. And so we proved that with this kind of procedure you increase regenerative therapy. When I perform the combined protocol, we can combine in the same section, and usually I inject a little bit deeper the hyaluronic acid, and after that I inject superficially the Seffiline. In this case, I'm injecting hyaluronic acid in the malar area. I'm injecting a little bit deeper with a microcannula, and after that I'm performing a carpet of cells over the hyaluronic acid. It's a very easy procedure, very safe, and which is, now I show you, now I'm injecting the tissue. You can see that when I inject the tissue, I'm injecting very superficial, just under the dermis, okay? With the cannula, you have to grasp under the dermis. This is the concept. You have to put the cells, you have to sew in the cells under the dermis, just to increase the regenerative therapy. The concept is why I have to combine hyaluronic acid and regenerative therapy. The concept is summarized in this phrase: okay, doctor, I love regenerative therapy, I believe in regenerative therapy, but the next week I have a wedding party or a big party, and so I want to toning up my chin. Okay, do you remember when I showed you the diagram of the volumizing effect of the regenerative therapy? In the first month, decrease very quickly, and after that, start to have the result. And so in this month, you can combine, you can fill the area with the hyaluronic acid a little bit deeper, and so hyaluronic acid in the months at the reabsorption. After that, start to work the Seffiline. Look, this is 4 months after the treatment, is in the cheek and zygomatic area. Of course, this kind of volume is not from 1 vials of hyaluronic acid after 4 months, but is from filler. But the patient stabilizes the volume effect thanks to the filler, the hyaluronic acid that inject for the first month. And you can combine the same section. Again, this patient, after 6 months, this enhancement in the quality of the skin, the toning up of the skin, is not from hyaluronic acid, that after 6 months, 90% of hyaluronic acid have already absorbed it. But now, you have this kind of result thanks to Seffiline. But the patient is super happy because the volumizing effect is stabilized. And again, just this week, we published this paper with the combination of Radies, the hydroxyapatite, and Seffiline. This is our publication, and now you can combine. The concept is exactly the same. You have the Radies, for example, in the man with the heavy skin. Maybe it could be a good idea to combine a superfluid Radies, and over you can inject the Seffiline. And again, the combination with thread, with suspension threads. As I told you, the main factors that are involved in the aging of the face is the loss of volume, the aging of the skin, and the descent of tissue. Of course, with the Seffiline, you correct the two main factors, the volume and the aging of the skin. But for descent, you can combine the suspension threads. You can combine the same section if you put the threads in the different area where you're injecting the Seffiline. Or you are to perform before the Seffiline, and after 1 month, 2 weeks, 1 month, you can put the threads. We published this work in the Journal of Regenerative Medicine and Biology's Research. This is an interesting study. We presented 213 cases of combination of threads and Seffiline. I will show you the video. Okay, in this case, I combine in the same section because I inject the Seffiline and the threads in the different area. The goal of this treatment is to enhance the jawline. And so I inject the Seffiline in the marionette area, in the perioral area, and then I inserted the threads in the lateral part of the jawline. Okay. When I perform the regenerative therapy in the perioral area, one of my favorite entry points is the middle of the chin. And with the middle of the chin, I can inject in the marionette area. And so, very superficial, I inject in this area. And it's very easy. You can inject, remember, inject very superficial. Usually, before the injection tissue, I inject a little bit of anesthesia with adrenaline, just to have a little bit of vasoconstriction, just to reduce the chemosis in that area. Okay, at the end of the injection, I perform the thread. The thread, of course, are in this part of the face, so it's not in the same area. Of course, there is different pattern to insert the threads. I use the silhouette threads with the cone, but there is a lot of different kind of threads. Anyway, the concept that I want to share with you is not use in the same area, in the same section, Seffiline and thread, because of course when we insert the threads in the area where we are injecting the Seffiline, the cone or the spine cannot hold the tissue. And after that, in this case, we are treating different area, and so you can perform in the same section. If you have to treat the same area with Seffiline and threads, before you treat with Seffiline, and after 2 weeks, 3, 4 weeks, you can perform the threads. Okay, that's it. Anyway. Okay, you can see the pre, immediate post, 1 week post, 4 month post. Okay, that's it. This is another case after 2 months. And this one is extremely interesting. This is from Rosalba Russo, the combination of Seffiline and threads. And you can achieve a result very close to a medical lift. Okay, and this one is the combination with endolift. We have here Dottoressa Riatta that is very skilled in this kind of combination, endolift and Seffiline. I think that you can achieve a very good result with this combination. Now I want to show you another special combination. In the same section, we combine Seffiline, endolift, and fractional laser. You can see this short video. This is the case. And you can see, of course, it's important to evaluate very well the indication. In this case, we performed the Seffiline in the periocular and temporal area, and the laser in the central part of the face, and then the lift in the jawline, in the same section. Here, the procedure are vesting. This is the endolift in the jawline. And when you perform in the same session endolift, Seffiline, and fractional laser, you have reduced a lot the swelling, and the recovery of the patient is shorter. Okay, Seffiline, and then, okay, harvesting. This part is already know. We can go a little bit quicker. Okay. Here the anesthetic solution in the periocular. I will show you this treatment of the temporal area, maybe in the live treatment, and so we can go very fast. And then the laser. Okay. Another important thing of the Seffiline treatment is the patient education. Oh, sorry. Is the patient education, because as I told you, the patient doesn't know this kind of therapy, and so it's important to explain to your patient that the regenerative therapy is not a filler, but it's a regenerative therapy. And this is a concept because it's important that the patient has the constancy to repeat the treatment, because the aging is going on, and so you have to repeat the treatment for stop the aging. It's not one shot. The therapy is curing your tissue. It's not like a cosmetic treatment, but it's a medical treatment. It's an anti-aging therapy. The best result will be in 1 to 2 months, and I suggest to repeat the treatment 4, 6, 8 months, depends of the condition of the patient. This is for me a very important concept. The anti-aging treatment, the constancy is more important than volume. Don't fill up too much the patient. Don't inject too much tissue in your patient. Inject only the right amount, and in case, repeat the treatment after some months. Anti-aging is not a destination, it's a journey. When you perform the anti-aging to your patient, it's not one treatment, but it's a journey. The patient has to be educated to take care of his tissue day by day. The Seffiline is not a liposuction. In these slides, I explain what the differences between the harvesting procedure and the liposuction. It's completely different treatment, and the harvesting tissue and the cluster selection of Seffiline is a medical procedure, and liposuction, of course, is a surgical procedure. Again, the injection of tissue is not a lipofilling, because when you perform the regenerative therapy, the goal is to regenerate the tissue. In the lipofilling, the goal is enhance the volume. The injection is superficial. In the lipofilling, the injection is deep. In the regenerative therapy, you are sewing, you are injecting the cells, but the stromal vascular fraction cells and mesenchymal stem cells, for us, the most important part of the tissue is this one. In the lipofilling, the most important part is the mature adipocytes. The result is dose dependent. In the lipofilling, the result is volume dependent. And this one is a medical procedure, and lipofilling is a surgical procedure. Last but not least, the differences between the PRP. As you know, the PRP is injecting the growth factor that comes from the granulation of platelet. And so I said that with the PRP, you are fertilizing your tissue. But when you perform the regenerative therapy, you inject growth factor, but also the cells. And so I said that you are fertilizing and sewing your tissue. And this is the main differences between the two things. And last but not least, the risk of injectable in the face. When I talk about this topic, I want to underline that this kind of risk is not only for the regenerative therapy, but for all kinds of injectable in the face of the patient. The only risk is the embolization of arterial branches. The first step is to know very well the pattern of the branches of the fascial artery, just to avoid any kind of problem. And when you know this pattern, you identify three dangerous areas: the glabella area, the nose, and the area close to the nostril. Because in this area, you have a particular pattern of the branches of the facial artery that if you clog this artery, you can have the skin necrosis or the blindness. My suggestion, first of all, at the beginning, avoid to treat the dangerous area. Second suggestion, if you inject an area that is dangerous, before inject anesthetic with adrenaline and wait some minutes, just to have the vasoconstriction and reduce the possibility to have the embolizing of the arterial vessel. Use linear technique and non-bolus technique, and in case of the needle of the cannula clogged, don't force the plunger, but change the cannula or the needle. Because if you force the plunger and the tissue come out very, very fast, can have high pressure in the tissue and can have the constriction of the artery, and so have the problem. In conclusion, the Seffiline is the unique device that is designed for medical doctor without any surgical skill, thanks to this system and this standardized procedure. Second thing, is the unique device that is all-in-one and disposable. You can find all the material for the procedure inside the device, and you can perform the procedure in your medical facility. Third, is effective. We proved that using this kind of system, using the microcannula and non-manipulate the tissue, you yield the highest amount of the viability and stemness of your tissue. And as I told you, the regenerative therapy is dose dependent. Effective and standardized. Thanks to the cannula, you are vesting the tissue where there is a bigger amount of stromal vascular fraction because you are vesting the superficial adipose tissue. And in conclusion, I wish to invite you to use our academy where you can find the course, the registration of course, the video treatment, workshop, video manual, is all in our library, and contacting the academy, Seffiline.com, you can you can see this video, you can see a lot of material. And then I wish to invite you to this WhatsApp group. Is an academy meeting place. You can write here to ask to join in this group. And in this group there is all the scientific board of the academy. There is all the main doctors that use this kind of treatment for all over the world, and so it's possible to exchange cases, opinion, asking questions, and going on. Okay, thank you very much for this part, and so if you have any question, I'm happy and I'm here to answer you. No gynecologist, please. Or I can call my gynecologist and can buy your phone, and so you can talk about it.
No, sorry, I didn't understand why you are preferring the hyaluronic acid filling without instead of the adipose tissue filling. Okay, this is regenerative treatment, and firstly I can harvesting the mesenchymal stem cells, neuromuscular fraction, blah blah blah this, and then I can take with another cannula. I think this is my opinion. Instead, in the whole treatment, it can, maybe it must be, I don't know, just I'm thinking like this. Another cannula, more traumatic cannula or more big cannula, we can take the adipose tissue, because if we're doing in the same time the filling with the hyaluronic acid, why we are not applying the saturated hyaluronic acid? We can apply the adipose tissue like the filler, and then the regenerative treatment. I think this is more safe than applying the hyaluronic acid.
Okay, I think that the concept of regenerative therapy is different from the concept of the filler. This is my opinion. If the goal is to fill it up the face of the patient, we have in the market a huge amount of filler. And it's unusual to stay here talking about to harvest tissue, to the procedure to harvest tissue. You can use wonderful filler and you can fill it up the face of your patient. But the real changing in mind, changing era in aesthetic medicine is to change the quality of the tissue of your patient. If the patient comes in my office and asks only to volumizing the lip, I open the drawing, I take a hyaluronic acid and I fill it up the lip. Very easy, very fast. But if I want to regenerate the skin of my patient, cure the tissue of my patient, I don't have anything apart this kind of procedure. And so when I talk about this kind of procedure, I focus, for me, the most important thing. I know that in time you have a volumizing effect, I show you. The volume, but it's a different volumizing effect. It's a full face toning up, it's not a volumizing effect. I hate the face of the patient that is filled up with filler, is transformed the face. This one is not my goal. It's not my way of see the aesthetic medicine. For me, it's the harmony, natural look, safety for our patient. And so for me, I want to emphasize, for me, it's of paramount importance to have the regenerative therapy, the cure of the tissue. To volumizing effect, you can open the drawing, you take a filler inject. Of course, when you use this cannula, of course you harvest also adipocytes. And so you have the volume. It's not the volume. You don't have to change the cannula. With this cannula, you have the same amount of adipocyte that you use with another cannula. Remember, if you use a bigger cannula, you are not harvesting more adipocyte. You are harvesting only bigger cluster. And so to inject, you have to reduce the cluster. To reduce the cluster, you have to manipulate and reduce the viability. Yeah. And so it's not a matter of the dimension of cannula.
But the time is lesser, and if I want the filler, yeah, I'm not talking the regeneration, okay, I'm okay with you, the regeneration treatment is different, but the patient's demands like this, feeling little more.
No, I give you an example. If I want to enhance the volume for a breast enhancement with a tissue, I perform a lipofilling. It's a different treatment. I want to enhance the shape of the buttock of my patient, I perform a lipofilling. I harvest the tissue with a liposuction, I wash the tissue and inject. But this is not a regenerative therapy. It's not an autologous lipofilling. But it's good when you need to have a big amount of tissue. To enhance the breast, you need at least 400, 1,000 ml of tissue. Of course, you harvest with a liposuction, but it's a surgical procedure. It's a completely different topic. But for the face, you never need to harvest a big cluster of tissue. Big cluster of tissue don't give you better volume enhancement. Remember, when you inject a big amount of tissue, inside the tissue, the cells have not the capacity to have the exchange feeding with the vascular area, and so you have necrosis inside the cells. When you inject a big amount, when Coleman inject big bolus of fat, you have the irregularity in the result, because inside the bolus of tissue, you have the necrosis of the tissue. And so never inject a big amount of tissue in the face, because you don't have a good result. You have irregularities, and you have lumpiness, and so on. Inject very fluid tissue. This is the key. And if you want only volume, take a filler and put the filler. It's easier and safer.
Question. This therapy is the regenerative therapy. It's not filler. It's tissue and not filler. I know, but when the future time, the ladies or men may take a kilogram or load. Of course, nature is different, abdominal and the face, because it can be worst view, the future, the patient take a kilograms.
Take
a kilograms, overweight, other than big fat.
Okay.
It's possible. Do you have any experience in your practice?
If I got your answer, your question is if I inject tissue and a patient change in weight in time, if you have any kind of difference in the face.
Sure.
That's it?
Correct.
Okay. The concept is, and this was the problem sometimes when you inject the lipofilling, for the concept that you are injecting a big amount of tissue in one area, and so you have necrosis in one part, in the other part less necrosis, and so when you increase the weight, you have the irregularity because you increase the dimension of the adipocytes. In this case, you are injecting a carpet of cells under the skin, and so you're tuning up in very natural and in full face treatment. And so the result that you achieve is not to change your face, but only to restore the tissue that you are losing with aging. And so, in case of increase your weight, it's like if you increase your weight when you were younger. And so there is nothing in natural. It's a natural increase your face. You increase the volume of your face, but in very natural, harmonical way.
So why don't we also use it, except for the subplant area, also for the deeper fat compartments to feed the adipocytes for nature, I guess.
Yeah. Actually, my personal opinion, the deeper, I don't believe a lot in this concept of the deeper compartment of fat. I'm a surgeon and I perform a lot of facelift, okay? And when you open your face, your fat is between the SMAS, the superficial adipose tissue, and the skin. There's nothing under the SMAS. There's a muscle, nerve, and vessels. And so this concept that is a concept that was introduced some years ago from Roerich, that talking about the different compartment. Different compartment is not different in the deep, but it's different in the area. So you have a compartment in the malar chin, the compartment in the zygomatic chin, but it's not different in the deep. Because you are the fat, the subcutaneous fat is only from the dermis and the SMAS, superficial muscular poneurotic system. Here there's a fat, and there you have to sew in your cells. It's not important to inject deeper. When you inject deeper was in a Coleman technique at the end of the 19th years, because the cluster of cells are very big, and so to avoid any kind of lumpiness and irregularity, they inject the tissue close to the bone. But it's not because the fat is close to the bone, but it's just to avoid the lumpiness and irregularities. The fat is only under the skin. It's between the skin and the muscle, not under the muscle.
Okay, but aging is on all layers of the face. So they also have osteoporosis. So maybe
Okay, that's it. Is another. I cannot correct osteoporosis with injecting, of course. And so I can only correct two compartments. With the regenerative therapy, I can correct the subcutaneous tissue and also the muscle and the vascularization of the muscle. Increase the tone also of the muscle because you are injecting endothelial growth factor, so you increase the muscle. For me, when you perform the regenerative therapy in the face, you are increase the toning up of the adipose tissue, subcutaneous adipose tissue, and the toning of the muscle, increasing the vascularization. But for the bone, I cannot do anything about the bone. The only thing that I think that could be performed with the bone, you can inject very deep the hydroxyapatite, and so you can increase with an injectable the bone, and this one is a good procedure.
If patients want more area, for example, face, the and hands, but we only harvest only 15 or maximum like.
This one is another important question.
What you advise to us?
Actually, you can harvest whatever you want. Okay, you have 3 syringes of 10 ml, so you can.
For example, patients want in one session all of area.
That is possible, of course, because you can use. You have three reservoir syringes of 10 ml, and so you can achieve 30 ml of tissue, and that is a good amount. But for me, I suggest you this must be a medical procedure, not too much, because if you harvest too much tissue, it's become a little bit heavy for your patient. Transform a medical procedure very easy, very fast, very quick in more heavy procedure with more recovery for your patient. And so I suggest you, of course, you can perform in the same session, but at the beginning I suggest you, if the patient wants to treat the hand, the face, the hair, for example, okay, I suggest you to split two procedures. Because to harvest too much tissue is not a problem, it's not a matter of the device. You can harvest whatever you want. You can stay 3 hours harvesting tissue and you can inject a lot of tissue. The problem is for your patient, because this patient, after that, was a little bit tired, could be a little bit tired about this procedure. And so I suggest you at the beginning to split the procedure in very short, easy, fast procedure, so the experience of your patient is a nice experience and not a too heavy experience. Because when you have to educate your patient, you have to suggest your patient to repeat the treatment. And so if the treatment is too heavy, the patient is a little bit scary to repeat the treatment. And so I suggest you short treatment, very easy, fast, very, very easy going for your patient, and so the patient is stimulated to repeat the treatment. This is my suggestion, but of course you can perform a bigger session and it's not a problem at all. E facciamo un break. Io avrei, come volete. Se volete fare il break, se volete fare il trattamento non lo so, io se volete un'altra mezz'oretta di cose da far vedere ce l'ho. Dobbiamo fare il Seffiline. Okay, your question is harvest the tissue,
And then
maintain the tissue,
Yes,
keep the
yes,
tissue,
yes,
and
yes.
inject after 3 to months?
Yes.
Okay, actually, I don't suggest to do this one. For a regulatory point of view, I don't know here in Turkey, but for example in Italy and Europe, it's not possible to conserve tissue of your patient only in a bank for tissue, and so it became extremely expensive, and there is no sense about that. And the second reason that the refrigeration of tissue to maintain the stemness of the tissue required a very high level of laboratory, and I don't think that in your medical facility you can maintain your tissue in this kind of condition. And so I think that the concept is so easy, so fast, that I have no reason to have this kind of risk to maintain the tissue for the second treatment. Perché io avrei, Arianna, io avrei ancora da far vedere il Seffiline, quindi non so se volete fare prima il break e poi faccio vedere il Seffiline 20 minuti.
Göstereyim, saç için uygulamayı mı göstereyim yoksa bir kahve molası mı?
Coffee break. I'm promising you that this part of my presentation will be shorter, no more than 20 minutes, to introduce you the Seffiline procedure, and after that we go with the live treatment. I put on my slides here, in case you have some social post pictures of this day. I'd love if you can tag Seffiline and my social account, and so we can share in the social, in the post, and so on. So Seffiline and Genai Chirurgia is my Instagram social account. Anyway, now I'm going to introduce you the Seffiline, that is the procedure for regenerative therapy for androgenic alopecia. This presentation will be shorter because actually the procedure is very close to the other procedure. I will show you only a little differences in the preparation of the tissue and the injection. Okay. Briefly, the concept is exactly the same. The autologous regenerative therapy, the mission is to make this procedure simple, safe, effective, and standardized in order to be performed by dermatologists, medical doctor, oncologist, and so on. Okay, the concept of the regenerative therapy in androgenic alopecia is to increase and regenerate the macro environment of the scalp. You know very well that androgenic alopecia is a problem that affects men, 70% of the men, but also 40% of women after the menopause, and so it's a very social problem, the androgenic alopecia. I don't want to bore you with all the passages of the hair. You know that the main factor involved in the androgenic alopecia is the dihydrotestosterone, the prostaglandine, but of course there's a lot of factors, the family, the lifestyle, and so on. Actually, I think that now the best way to get a diagnosis of androgenic alopecia is the trichoscope, and it's very easy. But anyway, I think that 80% of patients that come in your office saying that I'm losing my hair, the 80% is androgenic alopecia anyway. The pattern for men and women is different, as you know, and in Turkey, you know that you are very specialized in the hair implant. In the men, it's more easy to correct the androgenic alopecia or to correct the effect of androgenic alopecia with hair transplantation, but in women, sometimes there's not indication of hair transplantation because the pattern of the androgenic alopecia in women is completely different. And so the Seffiline find indication also in women for this reason. Okay, as you know, the adipose-derived stem cells play a fundamental role to to increase the quality of the microenvironment in the scalp, and so reduce the hair losing, increase the thickness of the hair, and stimulate the follicle to create new hair. There's a lot of references about the use of regenerative therapy in androgenic alopecia. I think the concept of the use of the regenerative therapy in the androgenic alopecia is the same concept when you use the regenerative therapy in aesthetics. Okay, the regenerative therapy became the center of your treatment to increase the quality and to increase the health of your tissue, and after that you can combine the physical treatment, the surgical treatment, and the medical treatment. But the center of your therapy must be to increase the quality and the health of the tissue of your hair. Which is the main difference between the other regenerative therapy, the Seffiline, the Seffiline, and the Sefficare? The main difference is that when you have to inject the scalp of your patient, of course, to inject the tissue is extremely painful, and a lot of time is not useful. And so the concept is to standardize a protocol in order to inject only the stromal vascular fraction without the adipose tissue. And so the first step of the procedure is exactly the same. Anesthetic solution, harvesting with the guide, everything is completely the same. You wash the tissue, the canting, and so on. The first difference is, as I told, the mechanical digestion. You have to perform 20, 30 passages from one syringe to another. Okay, very hard fluidification. You have to open, you can see in the slides, you have to open the cluster, and so you have to detach all the cells from the cluster, and after that you centrifuge for 10 minutes, 3,500 RPM. This procedure allows the stromal vascular fraction to move from the tissue to the infranatant, to the liquid part. And so in this way, you have a liquid part rich in stromal vascular fraction, and you will use only this part to inject in the scalp in the patient in order to have a completely painless treatment. Of course, we proved this protocol, and we published this protocol in the International Journal of Regenerative Medicine. And in this protocol, we perform the very heavy fluidification, 20, 30 passages. After that, we centrifuge the tissue, and we prove that after this procedure, you transfer the stromal vascular fraction from the tissue to the infranatant part of your tissue. This is the picture of the tissue after the centrifugation. You can see the separation of tissue and the infranatant part, the liquid part. Then in the device there is a long needle, and with the long needle you go in the bottom of the vial, of the tube, and harvest only the liquid part. After harvesting only the liquid part, you can inject with a multi-injector. It's a 7 needle, 3 millimeters in length, and 32 gauge, and so it's extremely thin needles, and it is quite painless treatment. You can see here the procedure. Anyway, as I told you, the procedure is exactly the same. Inject anesthetic solution, harvesting the tissue. After that, you transfer in the reservoir syringe. After that, you fill it up with saline solution to wash out. After that, you transfer the tissue. Okay? You transfer in the reservoir syringe. Okay? This one is exactly the same. Oh, exactly the same for all the procedures. You put in the decanting. After that, you add the tissue, and then you perform 20, 30 passages from one syringe to another in order to open the cluster and detach the cells. 20-30 passes, then you transfer the tissue in the tubes that are inside, of course, of the devices. The only thing that is not in the device, of course, is the centrifuge. Then you cap your tube, insert in the centrifuge, and after that, at the end of the centrifugation, I repeat 10 minutes at 3,500 RPM, you have the separation of the infranatant and the tissue. You can see, okay? Then with the long needle, you go through the tissue, touching the bottom of the tube. Okay, with the needle you go to touching the bottom of the tube and collect only the liquid part of your tube. Okay? And so, in the syringe, you have only the liquid part reaching stromal vascular fraction, and with this tissue you can treat the scar. This is the injection, very easy, very fast, quite painless, and this is the treatment. Okay, this is the quick guide for performing the treatment. Anyway, the scheme that I use, the schedule that I use with my patient for regenerative therapy is a little bit different compared to the treatment for the aesthetic treatment. I suggest usually, I suggest to my patients the first year to treat 2-3 times, the second year 1-2 times, and after that in the third year you can maintain result also with just one treatment per year. I love to combine, of course it's possible to combine, and I suggest to combine this treatment also in hair transplantation. In Italy, we have the Dr. Piero Tesauro, the past president of the Italian Society of Trichology, that is a great expert in hair transplantation. And we published this interesting paper combining Seffi hair and Fue just for cicatricial alopecia, and we achieve a very nice result in very difficult case with scar from accident or from radiotherapy, and the combination of regenerative therapy and hair transplantation give you a very great results. Another important combination in my hands is with carboxytherapy. I used to suggest to my patient that perform the regenerative therapy after the treatment to perform 5-10 treatments of carboxytherapy. You know that, and we published this paper with the combination of Seffi and carboxytherapy, and you can see that you have a very good results in order of perifollicular pigmentation reduction, yellow spot reduction, in density increase, and general improvement with the combination of Seffi and carboxytherapy. This is the scheme of the carboxytherapy, the setting of the carboxytherapy. Okay, this is the treatment. Anyway, so,
Posso fare io una domanda?
certo.
Allora, prima si comincia con carboxiterapia o si fa dentro trattamento?
Usually I...
Karboksiterapi önce bir başlamalıyız veya süreç içerisinde peki?
Onlar şöyle diyebilirim ben. Karboksiterapi ile aynı seansta karboksiterapi yapıldığında hücre membran reseptörlerinin aktivasyonu sağlanıyor. Hücre membran reseptörlerinin %30'u kadar aktif oluyor. Eğer karboksiterapi yapıp 6 saat, 5-6 saat sonra bunu yaptığımızda %50 oranında daha fazla, hatta %75-80 daha fazla aktive membran reseptörü elde ettiği için stomar growth faktör bir faktörü intraseller çalışan ajanlar olduğu için.
Comunque lui sta dicendo un protocollo molto bello, molto interessante. Comunque lei cosa pensa? Cosa dice? Cosa ci consiglia?
About the protocol with carboxytherapy, usually I take the opportunity of the 10 minutes of the centrifuge and my assistant performs the carboxytherapy in the same section. And after that, I suggest to patient every week, every 10 days to come to perform another treatment for 5-10 treatment after this treatment. This is the best, in my end, this is the best protocol with the carboxytherapy. But of course, we have different protocols. I had colleague, for example, now this is some cases, but anyway, it's you have the tricoscopy, but I want to show you other protocol that our colleague, this is dermatology Italian Dr. Galli. For example, the Tricopat. Tricopat is another device that some Italian doctors use after the treatment, and this one is another interesting protocol from Bovani, from Melfa. They use this, the Seffiline and Tricopat, Seffiere and Tricopat. This one, the result, very nice result. Tricobiolite is another combination. This is another protocol that is performed by Domenico Piccolo, another dermatologist in Italy. And so there is a lot of combination of treatment. But the main concept is the Seffiere is the main treatment just to increase the healthy of the tissue. After that, you can combine your own protocol for the treatment of the androgenic alopecia. Okay. In conclusion, after that, we are going to do a live treatment just for Seffiere. The first point, this is the unique device that is designed for doctor, dermatologist, trichologist without any experience in liposuction or surgical procedure, and the procedure is a guided procedure, the same of Seffiline, the disposable in one procedure. Actually, the Seffiere is the device that yields the highest amount of stromal vascular fraction for the androgenic alopecia. The main concept of Seffiere is the selection of cluster, emulsification 30 passages, and then centrifuge. So you can use only the liquid part to inject. You can use the needle or the multi-injector. In the device there is the multi-injector. Anyway, this is the brief introduction of Seffiere. As I promised you, it's shorter than Seffiline because we said the most important thing during the previous presentation. If you have any question, okay, or I'm going to change in my dress and we can go to perform the first live treatment of Seffiere. Okay? One question.
Is there any enzymatic or for the obtaining the fluid part from this harvesting? Is there any enzymatic or chemical separation in tube, or it is just only mechanical separation?
No, there is nothing chemical, nothing device to separate. It's only the centrifuge.
Why you are not thinking about the chemical or enzymatic separation?
I prefer don't use any chemical because it's not useful, any kind of chemical. This one is not PRP. You don't have to separate the platelet from the growth factor. Here you have the mechanical emulsification and you open the cluster. After that, we prove that just with this procedure, after that you centrifuge and the cells with the centrifugation move in the liquid part. And
what
so
about the inside the liquid part? Do you have any oily portion? Sometimes
no,
we can
the oily, the separation is
oily
tissue, no. The first layer is oily.
Yeah.
The second layer is tissue. The third layer is infranatant.
There is no oily part, right? If
No,
there is
in
an
the
oily
infranatant
part,
there is no oil.
it means that there is no enough mechanical separation. If there's sometimes I can get it.
What? Oily in the...
Yeah, sometimes it happens and I just throw it, and what is the reason? It is not the enough mechanical separation?
The oil stays in the first layer.
No. If we have the oil in the liquid part, it
Not
means
possible
that
in
it
this
is
device,
not enough
doctor.
mechanical separation. It is not enough the time for the separation, for the mechanical separation.
Maybe. I said that in our study, and we published, the 10 minutes in 3500 RPM is the right time and the right RPM to have the separation of the cells, and you find the different attempt only the stromal vascular fraction cells without any kind of other element in this infrared attempt. Of course, as I told in this kind of treatment, the stromal vascular fraction is a little bit less of the whole tissue, because of course in the whole tissue there is more stromal vascular fraction than in infranatant, of course. But this is the price that you have to pay to have a liquid part to inject.
Is there any contraindication? Is there any contraindication?
Is there?
Is there any contraindication?
Contraindication. Actually not, because this one is autologous homologous tissue graft, and so there is no contraindication. Of course, you don't have any kind of infection in the area where you treat or in the area where you are, but anyway, there is no contraindication, but there is nothing, is an autologous treatment, and so it's the safest treatment that you can do to your patient.
So, does the autoimmune status?
Or, for example, the alopecia areata is autoimmune, maybe is autoimmune.
It's not scabies. So, like fibrotic alopecia.
Fibrosis alopecia. Okay, of course, as you see before, the mesenchymal stem cells have also an antifibrotic activity, and so in this case, could be useful also to use this kind of treatment in fibrotic alopecia. For example, in a cicatricial alopecia, you can see that the injecting before the hair transplantation, injecting the tissue, allow to have the best result in the tissue to reduce the fibrotic of the scar, and you allow to inject the new follicles in the area. And so I think that you can have a good result in fibrotic alopecia too. Also in autoimmune alopecia, as areata alopecia, because as you know, the mesenchymal stem cells have also an activity in immune regulation, and so protect the bulb, the follicle from the autoimmune attack, and so could be useful also in alopecia, in areata alopecia. Okay. I suggest the Dr. Piero Tesaro prepare the scalp for hair transplantation, prepare the scalp 1 month before with Seffiline, perform the hair transplantation, and repeat the Seffiline after 3-4 months after hair transplantation. Okay,
orada size görüntü olacak. İstediğimiz zaman istediğimiz soruları da sorabiliriz. Evet, hep burada izleyeceğiz. Burası çünkü küçük bir oda, hep biz sağlamayacağız.
Dove posso andare per cambiare? Ho bisogno di un po' più. Perfetto, ok. See you soon. Don't fall asleep, and so I'm trying to make you awake, talking about a very interesting area to treat with regenerative therapy, and this sorry, and it is the periocular area. I think that this one is not the entry-level treatment, and so I suggest for the beginner that use regenerative therapy, don't start with this kind of, sorry?
I need an explanation or segmentation of you. And we have many similar devices and treatments in our clinics. For example, SPF is, we
have many, sorry?
Like many treatment and many devices like Seffiline. I've been using it for a while, but I also use some kind of mesenchymal tissue from the hair follicles with biopsy. Also, you know that it's a similar brand. And
yeah, I know very well.
Also, there's a nanofats. And SVN, they are coming with another name in Turkey. And there is many. And how do you segment your device with them? Benefits or this kind of approach?
First of all, talking about the treatment with the punch of skin here, and use the Regenera, the name is Regenera, and use the system to liquefy this punch of tissue behind her. Anyway, when I show you my paper, the comparison of the two papers with the stem, you remember at the beginning of my presentation, I will show you a study with the vitality in T0 and T72, the vitality of the cells. The other work, the compared work, is with Regenera and lipogems. At the beginning of my speech, I tried to explain that the regenerative therapy is dose dependent. And so, if you ask me in that system with the punch or lipogem like this, there is stem cells, my answer is yes. The problem is the amount of cells that you have in this tissue. And so if you want to have the efficacy, the effectiveness of the treatment, you have a higher dose of cells. And with this kind of procedure, you have cells, but the amount is so little. You are talking about 3,000-4,000 of cells per ml, compared with 250,000. And so I said, okay, this system you have mesenchymal stem cells, but in the other way is a very little amount of stem cells with this procedure.
Also, we have many, like autologous or allogenic fibroblast cultures. Also, we have some kind of exosomes coming from the core, mesenchymal core. Also, we have many options, and I need to segmentate all treatment in my clinic. That's why I'm asking your help.
Okay, you can, now we have to talk about marketing point of view of medical point of view. From a marketing point of view, you can segmentate all kind of treatment. But the medical point of view, you have to use the procedure that guarantee the higher amount of cells. And actually, the only treatment that guarantee the high amount of cells is this one, because you don't have to manipulate the tissue. And so if you don't manipulate the tissue, you have the highest amount. If you talk about exosome, okay, exosome, there is exosome in the market from vegetables or from cord, but anyway is heterolog or synthetic, are heterolog exosome. Exosome is a vesicle containing lipid, protein, and mRNA messenger. And so, if you have autologous exosome, is much better than other kind of exosome. And now we are proving that in the autologous tissue, there are the highest amount of exosome as well. And so, at the end, bottom line, I said that apart of the marketing point of view, I suggest to use the procedure that guarantee the higher amount of tissue. And the same concept for the nanofat, microfat, or like this. Nanofat is only a name, a market name, to say that the tissue that is under 400 micron of dimension of cluster. But I will show you that only with 5-6 passages you have the same dimension of cluster, but without any manipulation of tissue. And so again, you have in the tissue, you have the higher amount of cells. And so that's it, the medical answer. From the marketing point of view, this is up to you. But anyway, if you use this kind of procedure for the regenerative therapy, you guarantee the higher amount of cells, the higher amount of exosome, and you can use micro, nano, mini fat, whatever. It's only a matter of passages from one syringe to another. That's it. Okay, periocular treatment. As I told you, is not an entry-level treatment, but it's a very nice treatment because you know that for the beauty of the gaze, you have to consider that three main things are important: the highbrow position, the eyelid fullness, and the skin smoothness. And for this reason, for the highbrow position, talking about medical procedure, you can use, of course, the the botulinum toxin. You can enhance the volume of the tail of the brow with the Seffiline. In the next presentation, I will show you how to treat the eyebrow. And so you can combine botulinum toxin and thread to elevate the eyebrow. Or with surgical, you can perform the endoscopic brow lift. But anyway, talking about medical procedure, for the position of the eyebrow, the botulinum toxin and the thread are the only procedure. But the fullness of the eyelid and the smoothing of the skin, you can use Seffiline. I told you before the concept of the fluidity. Working around the eye, you need very fluid tissue. And for this reason, I suggest to use this kind of tissue. 5-6 passages, 500 micron, 21 gauge cannula. With this tissue, you can treat the eyelid, the upper eyelid, and the lower eyelid, both. The other thing is, when you treat this area, the treatment is under the orbicularis muscle. It's the only area in the face where you are injecting the tissue under the muscle. Otherwise, anyway, you have the skin in this area, the eyelid skin is attached to orbicularis muscle. And so it's not easy to inject above the muscle. But in any case, injection above the muscle, you risk to have lumpiness and visibility of the tissue. And so I suggest you to inject under the muscle. And for this reason, there is a special technique to have this kind of treatment. Now you can see in the cadaver the plane where you are going to inject. In the first picture, picture A, I inject the tissue, then I elevate the skin, and you can see the orbicularis muscle, and then I elevate the muscle, and you can see the tissue under the muscle. That is the plane where you have to inject the tissue, under the orbicularis muscle. And the same in the lower eyelid. You can see the injection, I lift the skin, here is the orbicularis muscle, I lift the muscle, and you can see the tissue here. So, in the eye, both in the upper eyelid and in the lower eyelid, the injection is under the orbicularis muscle. You know this concept, I already explained this concept, and for this reason, when you treat the periocular area, I suggest you to inject anesthetic solution with adrenaline 10 minutes before the treatment in order to have a vasoconstriction in that area. Okay, the entry point of the anesthetic, we start with anesthetic solution. The anesthetic solution creates the space where to inject the tissue. The anesthetic solution has the three effects. First, to reduce the pain of the treatment. Second effect, with adrenaline, to have the contraction of the arteries. Third effect is to create the space where to inject the tissue. It's enough 2.5 ml of anesthetic solution. Okay, the technique, now I show you the video for the technique of injection. To be sure to stay with this technique, you are sure that are under the orbicularis muscle. Okay, with the needle you touch the bone frame. You touch the bone frame with the needle, then you turn the syringe and go under the muscle. If you start touching the bone and turn the syringe, you are sure that your needle go under the muscle. Okay? Look, touch the bone and rotate the needle. Now I show you in the other side. And then you can inject in that space. But the first injection is touching the bone, rotate, and go under the muscle. Okay? Touch the bone, rotate the syringe, and go under the muscle. This is the magic movement to be sure to stay under the muscle. And with the same procedure, you are injecting the Seffiline. I will show you. You inject all the area. And for the inferior, it's the same. Touch the bone and go under the muscle. Okay? And so you are sure that stay under the muscle. Okay. As I told you before, you use this fluidification, 5, 6 passages from one syringe to another, in order to obtain a 500 micron tissue that is injectable with a 21 gauge microcannula. Okay, now I'll show you the treatment. I already injected the anesthetic solution. Okay, I don't show you all the procedure of harvesting because already we go blah blah blah blah blah. Okay, look. Okay, we start from here. Look, I touch with the needle the bone. I touch the bone. Okay. Then with the cannula, I touch the bone, rotate the cannula, and go under the muscle. Okay? In this way, is a very safe plane, and you can inject 1-2 ml of Seffiline under the eyelid. You are under the muscle, okay? Because it's very important for the gaze to have the enhancement of the volume of this area. Touch the bone of the frame. This is the frame of the orbit. You touch the bone, rotate the cannula, and go under the muscle. Very easy, very safe. Now we can see the same procedure on the other side. Okay? Touch the bone, rotate the cannula. Now I'm treating the eyebrow anyway. It's the same thing. Touch the bone and inject under the eyebrow. Okay. Now we go on the other side. I will show you in the next presentation this treatment of the tail of the eyebrow. Okay, touch the bone with the needle. You touch the bone here. Then with the cannula, go to the bone and turn under the muscle. Okay? Touching the bone and slide under the muscle. And after that, you can go through the medial part of the eyelid and then inject in the linear way. Okay? 1 ml, 2 ml, depends on the amount. No more than 2 ml. Okay? For the upper eyelid. But the same procedure is for the lower eyelid. You touch the bone, rotate the cannula, and go under the muscle. It's exactly the same. The amount is more or less 1 to 2 ml for the upper eyelid and for the lower eyelid. This one.
Why don't you use subdermal plane?
Questo è il temporal area. Okay, here is the lower eyelid. Sorry?
Why don't you use subdermal plane?
Subdermal.
Yes. Why?
Because for 2 reasons. The first one, in this area, in the eyelid, the skin is attached with the orbicularis muscle. And so the subdermal layer is quite nothing. And so it's very difficult to go under the skin. But the second thing that also if you can go under the dermis and inject under the dermis, the skin is so thin in this area that the risk is to have the visibility of the color of the tissue, the lumpiness, the irregularities. And so in this area, it's much better to stay under the muscle. Okay. Temporal and zygomatic area, we already talked about that. You have seen the live treatment, 2-3 passages, 600 micron, and so we can treat the malar and zygomatic area. As I can show you in in the light treatment, I make a little bit of anesthesia in the entry point, and after that I inject very superficial under the skin, in this case of course under the skin in subdermal layer, and I inject the tissue under the skin. Okay, so the result, but okay. You can see how is the enhancement in volume in the periocular area is extremely important to have an anti-aging treatment of the gaze. You can see is extremely, you can compare the two eyes. You can see that with the regenerative treatment of the periocular area, you have a younger appearance of the gaze. Again, in this very skinny patient, when you inject in the periocular area, you have an incredible increasing in the periocular area. Again here, of course, in this picture, I compare the same eye. I flipped the picture, but in the same eye, the right eye. Only one section. One treatment. One treatment. That's it. Only Seffiline here. Here only Seffiline. Sometimes I combine a little bit of botulinum toxin just to the elevation of the eyebrow. The picture is after 2 months after the treatment.
There is no toxin.
Sorry?
No, there is no toxin.
Toxin? No, sometimes I combine the botulinum toxin just to elevate a little bit the tail of the eyebrow. No, in this picture, not. I don't think. Maybe in one patient. In this one, no. In one patient, maybe I combine the botulinum toxin, and it's possible in the same section. Anyway, this is the patient education. We already talked about this, and now this is a question and answer. Okay. Another, of course, if you have any question, but I want to show you another interesting area to treat is the temporal area and the eyebrow area.
Dr. Cenal,
yes.
Do you think that it's also good for the sagginess of the eyelid? Your pictures look like that.
Let me, sorry. Now, tell me.
It's also, we can see the better contraction, elasticity. It's treatment of the sagginess of the eyelids. Do you think that?
Yeah, absolutely. Because when you use a regenerative treatment again, and so it's not volume, but also the elasticity, the quality of the skin. You have an enhancement in this part of the also regenerative the muscle. Because as I told you before, when you inject the tissue, you inject also the growth factor, endothelial growth factor. So also the muscle, the orbicularis muscle, increase the tone of the muscle. And so increase all the gaze in terms of skin and in terms of muscles.
And there is very nice opening of your pictures, yeah.
Of course, because when you increase the volume, increase the elasticity, the images is to open the glance. The gaze, sorry.
First advance.
Okay.
May I ask you a question?
Please?
Do you also prefer to treat the patients who has also eye bags? Under eye bag? Do you also
Bag?
Yes,
Eye bag. Actually, of course, for the right, the right therapy for the eye bag is only the surgery, the inferior blepharoplasty. This is important to say. Sometimes, if you enhance a little bit the volume and the tone of the skin under the purse, here, the herniation of the fat, you can a little bit cover the problem.
like a makeup effect?
Yeah, but actually the therapy for the eye bag is the blepharoplasty, of course. Okay, again, the condition, eyebrow position, temporal fullness, eyelid fullness, and skin smoothness. We already talked about eyelid fullness and skin smoothness. Now we are talking about the temporal area fullness and the eyebrow, okay? This is the area that we are talking now, okay? The temporal area and the eyebrow. You know that a lot of your patients have the problem that aging, they lose volume in the temporal area. So it's very important to restore the volume in this area. To restore the tone is better. When we are going to treat this area, you have to focus our attention in some anatomical key point. First of all, the temporal branch of facial nerve. As you know, the facial nerve is a nerve that creates the mobility of the frontal muscle, and so it's extremely important, of course. And the pattern of the pathway of the branch of the temporal branch of the facial nerve is start very deep from the parotid gland, go very deep until the zygomatic arch, and when arriving in zygomatic arch, move superficial and go very superficial under the skin. And so, first of all, this is another important thing to know. In this area, the temporal branch of the facial nerve is very superficial. Second key point, anatomical key point, are the superficial branches of temporal vein and artery. Again, both these vessels are very superficial in this area. And then there is the orbicularis muscle and the supraorbital nerve. That is a sensitive nerve here. Starting from this consideration, anatomical consideration, the plane where we are going to inject the Seffiline, we use two entry points when you treat this area. This entry point is up to the temporal crest, like here, and the second point is here, just in front of the hairline. This is the entry point. After that, you go to inject the tissue above the temporal fascia. In this area, there is a temporal muscle. When you try to squeeze your teeth, you see the temporal muscle, the muscle that is in the temporal area. Okay. This muscle has a very heavy fascia. Okay. You have to slide over this fascia with your cannula. It's very easy and very easy plane, but it's important to stay above this fascia, because if you slide with the cannula above this fascia, you are sure that facial nerve, lateral branches of temporal vein and artery is above your treatment. So you slide over the fascia, and so we are sure that all the anatomical structure are above you, okay? So the injection is above the temporal fascia. This is one entry point. This is the second entry point. We have two entry points, and you cross the injection, okay? But both the entry point in the temporal crest and the entry point above, in front of the hairline, when you insert the cannula, you have to slide on the temporal fascia. But it's extremely easy to do this one, because the temporal fascia is very strong, and so the cannula cannot perforate the fascia. So when you go down with the cannula, when you feel the stop of the cannula, you are on the temporal fascia. After that, you turn and slide over the temporal fascia. Very easy treatment. Okay, the injection must be above the temporal fascia. And when you stay above the temporal fascia with both the entry point, we are sure that your injection is under the facial nerve, under the temporal artery and vein, and under the orbicularis muscle. You use this fluidity. You can use the fluidity 2-3 passages, 600 micron cluster dimension and use the 20 gauge cannula. This is the treatment, okay? This is the preparation, but we already know this one. This is the case that I'm going to present you. You can see this patient. These ladies have a very hollow temporal area, and so I think that in this case is a very good candidate for the enhancement in the temporal area and the eyebrow. Okay, first of all, the entry point. I mark the entry point. This is the entry point for the temporal crest. And the second entry point in front of the hairline. And then I'm showing the line of injection, okay? Also for this treatment, I start with the injection of anesthetic solution. In the two entry points, I create a puff of anesthetic solution in the two entry points. And then I inject some other spot in the area, then I massage in order to spread the anesthetic solution, and so the patient had the best feeling during the treatment, and the treatment became painless. It's enough 2-3 ml of anesthetic solution, the same anesthetic solution that you use for harvesting area, the same anesthetic solution, nothing more than this. After that, you go with the needle, you touch the fascia, okay? When you use the entry point in the temporal crest, you touch the bone, enter with the cannula, touching the bone, slide over the fascia of the temporal, muscle fascia, and then inject. Don't be afraid if you see that during the injection you can see any kind of lumpiness. After it's enough to gently massage and the tissue spread in the area. It's very easy, very safe. The cannula is sliding over the fascia. And so you are sure that above the cannula there is the fascial nerve and the vessels. This is, now I go to the entry point above the hairline. I touch the fascia. It's very hard, the fascia. So you can touch with the needle, you can feel the fascia. Then you go with the cannula, you touch the cannula, slide over the cannula, and go treating the eyebrow. You can see. You can inject under the eyebrow, you are under the muscle. And here you are under the skin or above the temporal fascia. The treatment is very easy and very safe because the temporal fascia is very stiff, and so the cannula can slide very easily over the fascia. Of course, 90% of the case that I treat the temporal area, of course I treat also the malar and zygomatic area in order to have a very natural passages between the temporal area and the malar. And in this case, I treat also the temporal and zygomatic area in order to achieve a very natural result, very smooth result between the fullness here and the fullness in this area. And so here I'm treating the malar area, as I showed you this morning in the live treatment. The lower entry point, the same of this morning when I show you the treatment. And from here you treat again the zygomatic area and the malar area too. Okay, this is the left side. You can see, compare the two sides of the treatment. This is the other side. Okay, I inject the anesthetic solution. This is the temporal crest entry point. I'm injecting some puffs of anesthetic solution. This is the entry point in front of the eye line. I inject here too a puff of anesthetic solution, some other puff around, then I massage in order to spread the anesthetic solution. I wait some minutes, and after that, we start the procedure. Okay, in this entry point, I touch the bone with the needle. I touch the bone. After that, with the cannula, I touch the bone again. I rotate, and I go towards the tail of the eyebrow, and I inject in the linear way. In that area, I'm under the orbicularis muscle. And in the temporal area, I'm sliding the cannula above the temporal fascia. Okay. Now I shoot the other entry point. The other entry point in front of the eye line. You touch the fascia. Then insert the cannula, and touching the fascia, you slide over the fascia again. You can treat all the eyebrow. Okay. Again, now I'm treating the malar area, malar and zygomatic area. In this case, for example, I'm using more or less 5 ml in the temporal area, and more or less other 5-6 ml in the malar and zygomatic area. And so I use 10-12 ml per side, and so this is a treatment of 25, around 25 ml of tissue. And so this is a treatment that you can perform in one session, of course. And here the other treatment. Okay. This is the result. You can see here, unfortunately, the Vectra system cut the resolution in this area, but anyway, you can see the distribution of the tissue around the face. It's possible to combine this treatment with botulinum toxin. I suggest to don't perform the botulinum toxin in the same session, because with the edema, the botulinum toxin can spread in other area. So I suggest you to treat with botulinum toxin 1 week before the treatment or 1 week after the treatment, but not in the same session. Suspension threads 3 weeks after the treatment. And of course, you can combine filler with hyaluronic acid or radiesse, and you can combine the same session. This one already, I stressed this concept. I already said this concept. Again, this one, okay. Very well. Any question? Why don't you use front? No, it's possible to treat this area too. Yeah, I suggest when you want to treat this area, you can use also 1 or 2 entry point from the middle. You can inject under the skin here. I suggest to use a more fluid tissue, for example, 5-6 passages with a 21 gauge cannula, and you can inject. It's a very good result. You have to advise your patient that can have a little bit bruises, because here there are microvessels and you can have some bruises, but the result is very good. And in this area, I strongly suggest to combine with the botulinum toxin, not in the same section, or 1 week before, 1 week after. Okay. Last but not least, let me check this one. Okay. The last topic that I wish to present you is the concept of safety of this kind of procedure. Because I think that talking about a medical procedure is extremely important to prove that this kind of procedure is extremely safe. And so, for me, the safe is one of the most important things in this kind of procedure. Okay, you use the guide, and so the guide is okay because prevent any risk to go deeper in your patient. You have the disposable all-in-one device, and this is another important thing for the safety of the procedure. The low dose of anesthetic solution is another important thing for the safety of the procedure, and the procedure is extremely fast, and this is another important thing for the safety of the procedure. Anyway, we are publishing this important multi-center study. I'm sorry. And in this study, we collected 2,365 patient treatment performed in 10 medical centers around Italy. And we collect all the cases and we compare the problem, the complication about these cases. And so this is the 10 medical centers that participate in this study. Of course, we gathering a lot of cases, not only Seffiline, but also the Seffiline combined with different other treatments. For example, combined with botulinum toxin, hyaluronic acid, threads, microneedling, radiesse, carboxytherapy, endolift. And so we're gathering all this kind of treatment combined with the Seffiline. The only Seffiline is 63% of cases are only single treatment, but in the other 37% of the case, you combine Seffiline with other medical procedure. And after that, we collect all the complication, both from the donor side and the receiving side. And so, first of all, you can see that the only complication, if you can call like this, in the donor side is the ecchymosis. Hematoma is 1.3%. Skin irregularities is 0.2%. So we can say that the complication in the donor side are extremely low. And now we are checking also the complication in the in the face, in the injection site, and you can see that all the complication is under 1%. The only that is ecchymosis, of course, because when injected, some ecchymosis is possible that occurs. But all the other kind of complications are extremely low. It is interesting to compare our study with another study, very recent study, 2022, published on Clinical Medicine, Journal of Clinical Medicine, that is collect more than 5,000 cases of effective grafting in the face, and if we compare the complication and we divided the complication in severe, moderate, and minor, you can see that severe complication 1.6 in that study and 0 in our study. the moderate complication 2.2 in that study and 0.4 in our study, and minor complication is 2.6 in this study and 0.6 in this study. And so this is the proof that the Seffiline procedure is extremely safe procedure. The naturalness of the result, but to evaluate this part, I can show you some results, not only from my cases, but also cases that come from other colleagues. You already see this case. You already see this case too. This is a man. You can see it's important to have a very natural look also for men. And we have, of course, cases from other colleagues, Italian colleagues, like Dr. Piccolo in this case, Dottoressa Russo in this case, Dr. Mefe in this case, Seffiline plus Radies, or endolift, Dottoressa Baldessin, Seffiline and endolift. Or you can have from all over the world. I have some cases that sent to me. This is a Dr. Carti that is working in Romania and in Dubai. Or you have Dr. Felipe, Inigo de Felipe from Spain and United Kingdom. From Spain, Dottoressa Irma Gonzalez, Vice President of Spanish Dottoressa Riatta. And so we have some cases. This is from Capare, from Sweden, I guess, or Norway, I don't remember. Anyway, in conclusion, I can see that the safety is a main concept. I focus on the safety of the procedure, and we prove that this kind of procedure is extremely safe. Again, with this study that is under publishing, we can prove that this procedure has very lowest rate of severe, moderate, and minor complications. And also, the concept of the naturalness of the results, because this one is not a filler, is not another procedure, but it's a procedure that is cure the tissue of the patient. And of course, it is a procedure to rejuvenate and regenerate the tissue. Okay, now I swear that I'm finished, and so if you have any question, it will be a pleasure for me.
Thank you.
It was a very long day. I hope that, I know that it's a little heavy day for you to listen a lot of things. I hope that you enjoy this day with a lot of information, a lot of things, and of course for any other question you can stay in touch with me through Dr. Eyup. You can take in touch with me, and for any needs, it will be a great pleasure for me to help you and to share with you my experience anyway.
Thank you so much. Grazie. It was really.
Sorular var. Sorulara bakalım.
Oyun uygulamasında var mı acaba hiç gösterebileceği?
Efendim?
Bu oyun içinde bir uygulama var
Sorry?
mı?
C'è qualche trattamento per il collo che si può far vedere?
Ok, non ho con me dei video sull'argomento. It's possible, of course, to treat also the neck and the decollete area. In this case, you have to fluidify a lot the tissue, because you need very fluid tissue just to avoid any visibility of the tissue in this area, because here the skin is extremely thin, and so you have to fluidify 20-30 passages. Or you can decide to use the Seffiline system, and so centrifuge the tissue and use only the liquid part. It's up to you, depends on the thickness of the patient.
You got experience about
Yes. I treated some cases with burn scars, and I said the result is very interesting. because increase, you know, the mesenchymal stem cells have the antifibrotic property. And so when inject under the scar, the most important thing is inject very, very superficial under the scar, and so you increase the elasticity and the smoothness of the scar. And so I had a very good result in these cases, but the most important thing is to inject very, very close to the scar, very superficial, just under the scar, and to repeat the treatment 2-3 times in a year.
So you better use Seffiline.
Sorry?
Seffiline protocol is better for scars.
Seffiline?
Yeah.
Actually, no. I think that Seffiline is very good. You have to fluidify it. Seffiline for the scar. I think no, it's better because remember, when you centrifuge and you use the infranatant, you are losing a little bit of stromal vascular fraction. And so, in case of the hair, you have this, you do this procedure because it's extremely painful to inject the tissue in the scalp, because the scalp is very thick. But in the other case, if you can, it's better to use the whole tissue. In case you can fluidify it a lot if you need more fluidity, but it's better to use all the tissue, because in any case you have more stromal vascular fraction in the whole tissue than in infranatant tissue.
What will be the concentration of the
Sorry?
Nikon for scar operations? Scar
How many
treatments?
passes?
Yes, more than 6.
No.
For this, how many?
Talking about TB.
Okay, in the scar, I think that if you can 5-6 passages, it's okay. For the same that you use for the eyelid, in the scar for the face, for example, in burn scars, you can 5-6 passages and then inject very, very superficial.
Maybe we can do the same with scar tissue and fascia too. We can.
Actually, so I have some colleagues that inject the whole tissue also for alopecia anyway. It's not easy and it's a little bit aggressive to inject the tissue in the scalp, because, of course, also if you perform 20-30 passages, it's not possible to inject with the multi-injector, with a 32 needle, and so in any case it's not easy. You have to use a bigger needle, and so it's a little bit better. But in some cases you can perform also in the scalp.
For some dermatological diseases like lichen sclerosis.
Yeah, we have a good, we have a very good result in lichen sclerosis for penis and also in the vagina, yes, and also in the scalp. And so you inject the whole tissue. In this case, you can inject and there is very good result in lichen. Yes.
In case of any irregularities,
In case.
irregularity, for example, I made a mistake and there's some more product or more superficial, or I didn't take enough passes, that is permanent.
Actually, it's very, if you inject superficial in linear way, you don't have any concern about that, because the tissue spread is not a filler, but when you inject, the filler fixes in that way. The tissue is moving under the skin. So suggest to the patient, gently massage, and after a few days, everything disappears. Don't worry.
For example,
For the neck, yeah. For the neck, if you use very fluid tissue, you don't have any problem about that. Don't inject the tissue with a big cluster here, because otherwise you can have some irregularities. Not permanent, but can stay for lasting for a long time, yeah.
Emboli sorusu vardı. Emboli değil mi?
Evet, olursa belirtisi ne olur, tedaviden öner.
Emboli olursa enjeksiyon esnasında ne yapıyoruz?
C'è complicanza in mentre che stai facendo l'iniezione l'embolia.
Okay. Actually, the embolism never occur in more than 200, 2,300 cases. In case of the embolism, in this case, is more could occur, I think, more than for real embolism, is occur if you inject too much tissue in one injection. And so there is the compression of vessels more than the embolism of the vessel, because it's very rare the embolism of the vessel. In that case, you have to massage the area, and in extremely case, you can apply the band with for the heart attack. Nitroglycerin, yeah. But it's very remote possibility anyway. I never seen embolism with kind of treatment. Yeah, the bolus injection for this region you have to avoid any kind of volume injection, but all the time you have to linear injection. Linear injection, you have to spread the tissue, and in this case it's quite impossible to have embolism or compression of artery.
Thank you.
Başka soru var mı? Yok. O zaman ben Profesör Cenna'ya hepinizin de çok teşekkür ederim.
Dottor Gennai, a nome di tutti i miei amici medici, concorre.
Valla İstanbul'da iyi bir ev sahipliği yapamadık ama Kuşadası'nda inşallah bunu tekrarını yapacağız.
Forse non è andato tanto bene, però dobbiamo aspettare a Cusciadassi.
Oh, thank you very much, and I appreciate a lot, and thank you very much for having me.
Türkiye'ye geldiği için ve bu yani güzel bilgileri bizimle paylaştığı için teşekkür
Se
ederim.
la ringrazio.
Thank you very much. Thank you very much. Now I want the picture with this one, please. Someone take the picture. Thank you very much. I appreciate it. Thank you and compliment for the organization and compliment for
Türkçe yazdırdık. Neden yazdırdık anlamasını da. Bilerek İngilizce, İtalyanca yazalım mı dedik geldik. Türkiye'ye geldik. Türkçe verelim dedik. O yüzden Türkçe yazdık. Şimdi hem ara verelim hem de bir yandan da sertifikaları verelim ki Cenna'yı uçağını yetiştirelim. İkisini bir yerde halledelim isterseniz. Şu köşe resim için iyi mi? Yoksa? Bu resimleri WhatsApp grubunda zaman hepsini paylaşalım orada. WhatsApp grubunu herhalde bugün akşam kurarız. Bilmiyorum.
Niente. Volevi sapere cosa voleva dire quella frase? Volevi sapere cosa voleva dire? Cominciare un nuovo cammino. A volte può essere pauroso, ma c'è cosa che a ogni passo era molto più pericoloso restare fermi.
Necla Hanım. O verecek. Ben doktor arkadaşlara vereyim, onlar şimdi orada çekilsin.
Deniz, Mustafa Karakuç'a yazdı. Benim yazdım. Yeni yazdık ya. Ne söylüyorsun?
Hadi görüşürüz.
Hakikaten tam
Selfie buraya bir de bakar mısınız? Herkes buraya baksın. Eyüp Bey buraya bakın. Buraya bakar mısınız? Selfie.
Bize korkuyor.